One thing that most dentists struggle with is case acceptance. And it's true that you're not going to sell 100% of your solutions to patients' dental problems. Nobody does. But there are many reasons that you're not selling as many as you think you should be. And those reasons could begin with you. After the break, I'll be back to tell you how to get out of your own way. I'm Colin, founder and CEO of SmartBox, and welcome to the Patient Attraction Podcast. Now, in case you're new to the podcast, let me tell you a little about me. My dad's a dentist, and I spent a lot of hours in his practice growing up and working in it. I combined at an early age my love of computers with my understanding of dental practices to create SmartBox, and now we work with over 500 dentists on 3 continents to help them attract more patients, get more profits, and have more freedom. So, I know a lot of dentists, and I know that case acceptance can be quite a problem for a lot of dentists that I talk to. I've been thinking about why that is, and I have a few ideas to share. First off, let's start with the obvious. You didn't go to dental school to learn how to sell. No, you went to dental school because you love dentistry. You went to become an expert with solving the problems that your patients are having clinically. And I doubt that many, if any, dentists have any background in sales. Which leads to my first point. Selling your case solution takes you out of your comfort zone. Now, it's human nature to be cautious and reserved when you're trying to do something important that you're not trained for. But that very cautious and reserved can make you appear uncomfortable in front of your patients. Now, second, those patients are probably very anxious about what you're going to propose. They're feeding off your anxiety and also how much it's going to cost. And that's just a formula for sales failure. It builds a wall between you and your potential patient. Now, you've probably learned a few techniques to help put patients at ease, but have you learned anything to help you? Or are you still fighting yourself when it comes to selling? Now, there's plenty of classes that you can take to get more comfortable with selling. Here's my third idea. In my experience, what works best is to stop thinking about yourself. It's not you versus the patient. Because you both want the same thing. You want to help that patient. The patient wants to help themselves. You want their dental problem to be solved. Keep the patient's welfare at the top of your mind during case presentation. You'll be a person that happens to be a dental expert. And if it's a dentist you versus person you, everybody loses. Until next time, keep moving forward.